can they make to live with this condition?
Thanks. That's a very valid question, a very good one, because not many of the patients are interested or ready for surgery at the first go. So what we do is we will start, of course, first with the medications. But then we give lots of modifications. One modification comes around smoking and alcohol intake. So we tell them stop if you can, reduce if you can't stop. But ideally, if they're able to stop, that is good enough. Number two is weight reduction. Usually when there's a lot of belly fat, then there's a lot of pressure coming back into the stomach from outside, from the belly fat outside the stomach. And that might be contributing to the pressure inside the stomach that is pushing the contents back into the esophagus. So when the patient is able to lose some weight, then that helps. And number three is now in terms of position. If you assumed that when a patient is lying flat, that whatever is in the stomach is flowing back to the esophagus, then you can imagine if you tilt them up a little bit, that then whatever wants to flow back to the esophagus will be going against gravity. So that is pure physics and pure gravity. So we encourage patients to prop up the bed or lie on 2 or 3 pillows. That will help so that it doesn't flow. Then we talk about food. We talk about how much can you take. Most of us will remember when we were growing up, for those who grew up in the village, during Christmas, we'll go from homestead to homestead, eating. By the time you are done with going down the village, the stomach is so full you can't even sit upright. You are sitting at an angle and you are always belching. So that tells you that if you overfill the stomach, that neck that is supposed to create, a barrier mechanism is completely lost. Take the example of a balloon. If you blow the balloon just a little, it will have a long neck. But the more you blow into the balloon before it bursts, it will have eaten into the neck. You can't even see where to tie. So that is the assumption that patients have to have in their mind, that if you fill the stomach completely, then that area is supposed to have a sharp angle. We call it angle of ease. Over time, when the stomach is completely full, then that angle is interfered with, and therefore then food can come back. So we tell the patients, don't overeat and avoid taking water after meals. It's easier to just take water or liquid as you feed, because if you now finish the dinner, for instance, and you come take a glass of water, then the water is floating on top, for lack of a better way to explain it, and it's easier. That is easier to reflux than if it's part and parcel of the solid food you've taken. And then finally, of course, is the issue of timing between eating and sleeping. If someone eats and sleeps immediately, they wake up feeling, I feel like I haven't digested my food, I feel like I'm bloated, it's something, I feel I'm having a heartburn or something like that. It's the same. So tell them, if you sleep at 9 p.m., eat by 6, by 7. If you have 2 to 3 hours of, being upright and the food has been, emptied out of the stomach. We encourage patients to chew gum. It's an interesting thing. Patients look at me and wonder whether I'm joking. But ordinarily, patients with reflux subconsciously swallow saliva a lot. Subconscious because when the acid comes up, it is natural to swallow saliva, to just have the cleansing mechanism, just the physical sweeping of whatever acid is coming up. But the second bit is because saliva is basic. It has something called salivary bicarbonate. So when it comes, it's able to kind of neutralize the acid and reduce the acidity up. There is a question I usually don't like to go into, which is what can I eat, what can't I eat? Because you become so prescriptive and you can't quite tell what the patient will eat. You give them a list, and the list you've given them is only available to people who probably reside in the coast, and the patient lives in northeastern. So the thing is to tell the patients, you know your body well, you know what food gives you trouble. Avoid that if you can, and if you have other ways and other sources of nutrition, then as long as you have a balanced diet, avoid the food that causes you trouble, and then follow all these other lifestyle modifications. So we do those, and they work. They work for quite a number of people. And some people come and say, I'm okay. After 2 months or 3 months, I even stopped my tablets. I'm doing okay. Other days, they come and say it's bounced back. But as we mentioned earlier, patients like the one we have will come and say, yeah, I know medication works, but I'm done with medication. I just want a surgical option. And that is not, it's not a bad thing to say, because surgery surgery is scary, but also surgery is safe.